morning, friends. Welcome to Dr. PM Times. This is Dr. Murugesan. Friends, in this series of episodes, I am going to concentrate on an important non-communicable disease which is very prevalent in this country now, that is diabetes mellitus. I will be talking about what is diabetes, what are the different types of diabetes, mainly type 1 and type 2 diabetes, and how to differentiate these two. We'll also discuss the stages of development of diabetes into an established disease. We will discuss about the important hormone insulin, the basics, how it is secreted, how it is released, what is the half-life, etc. Then I will concentrate on the treatment, especially insulin being the best mode of treating diabetes. The first episode, we will first see what is diabetes. As you all know, diabetes is mostly due to a defect in insulin secretion or a defect in insulin action. But insulin alone is not responsible for all the manifestations of diabetes. Diabetes is in fact a heterogeneous metabolic disorder characterized by chronic hyperglycemia, which involves not only the insulin. Of course, insulin is the main hormone whose deficiency is the cause for diabetes, but there are other hormonal involvement also. So it is a multi-hormonal disorder. That's the point I want to stress in this episode. The first defect in diabetes is, of course, a decrease in insulin secretion. There is an absolute or relative deficiency of insulin causes diabetes, and there is also a moderate increase in the level of glucagon, which is another hormone secreted by the alpha cells of islets of Langerhans, which is situated near the beta cells of islets of Langerhans. Also, there is also a lack of a group of hormones called incretins, which are secreted by the duodenum in response to food intake. When food, partially digested food, reaches the proximal part of the intestine, it releases a group of hormones called incretins, mainly GLP-1, otherwise known as glucagon-like peptide, and GIP or glucose-dependent insulinotropic polypeptide. What these two hormones, that is incretin, does is, in response to oral food intake, they go and stimulate the tail end of pancreas where the islets of Langerhans are situated, and they stimulate the beta cells to release insulin. And this insulin tackles with the elevated blood glucose level after the digestion and assimilation of the carbohydrates that we take. So it is a physiological basis of stimulation of insulin secretion from the beta cell. So the lack of incretins also is the cause for all the manifestations of diabetes. Apart from this, diabetes is also related to the leptin hormone. You all know leptin is a hormone secreted by adipocytes of fat that is mainly deposited in the abdomen. And this leptin physiologically acts on the hypothalamus and induces satiety. It says that to stop eating when the stomach is full. Without leptin, we will continue to eat, which can cause increased blood glucose level or overload of carbohydrates. What happens in diabetes is there is also leptin resistance, just like insulin resistance, and the leptin that is secreted from the adipocytes in obese individuals are defective leptin, which are physiologically inactive. So they are not able to do their physiological function of bringing about satiety by acting on the hypothalamus. So these individuals are prone to eat more, which will add on to this problem of hyperglycemia, which is the main problem in diabetes mellitus. Also in diabetes, there is one more defective hormone called amylin, whose deposition in beta cells are predominant in type 2 diabetes, chronic diabetes. And this is associated with the defect in insulin release by the beta cells. So to summarize or to conclude, diabetes is not due to lack of insulin or lack of or deficiency of insulin or defective in insulin action. It is also due to lack of other hormones such as incretins, defective leptin or leptin resistance, defective amylin, and also a moderate increase in glucagon. So it is a multi-hormonal disorder. So to control or conquer diabetes, we have to take all these things in mind and act accordingly. Thank you, friends.